How do we fix our healthcare system?
Let's try getting rid of these nurses for hire these nurses on steady, put them in the healthcare system, hire some doctors, pay them to be in the healthcare system, and open things up.
The system is good in the sense that it's a social system, but it's not good and there's just not enough resources for it, which could be the doctors, nurses, other care workers, but also the idea that there has to be a whole revolution around how services can be delivered. Like, I'm going to need some prescription soon. I just moved here recently. I don't have a doctor here, so I should be able to just go online and make an appointment with a video doctor and they check it out and give it to us. So streamlining it for the convenience of everyone rather than it being a bureaucracy.
I think it's gone too big. Everything's gone too big and it's become heartless because it's in a computer now. It's not in the people's hands anymore. It's in this AI system, and we're not computers, we're people. We need the human touch again.
If New Brunswick at least had some sort of program where we would pay for like maybe nurses and doctors education, and if they like stayed in the province for 5 to 10 years, their like education costs could be covered. Like it wouldn't be a quick fix, but maybe a long-term one.
Fix our healthcare system. There's a lot of areas that require investigation, and we need to start disseminating what's actually going on in our healthcare system. We can't just blame younger generation and new doctors that don't want to work or stuff along those lines. Like, we got to recognize the complexity of care is going up. We got to recognize that the population, especially in New Brunswick, is aging, which is, increasing the amount of people that are in beds in hospitals, decreasing the amount of beds that are available in ERs, increasing the amount of time the family docs have to spend with patients. There's really some root causes that need to be figured out and disseminated to the general public so that people can start figuring out how to fix them, as opposed to just trying to blame it on one thing or the other.
How do we fix our healthcare? I think we need to talk to the healthcare professionals and see what they need and work together. I mean, we have a lot of folks that have credentials, but some of those credentials aren't recognized here in Canada. So I think it's time that we do that. I think it's time we look more towards nurse practitioners to help with the burden of people not having doctors and those type of things. So I think there's ways that we can do that, but we can't always look at the way we've done things before.
If I knew, I would tell you, but a suggestion is that we allow more practitioners per area than we presently do, particularly in Quebec. It's a very serious problem, and it inhibits, perhaps, trained physicians from staying here.
Privatize. So I would have Canada at least, well, now it's what, a third private, it's 2/3 public if you look at the amount of budget. And what I would do is I would just have a lot more private, like France or like Australia. No reason that you can't imitate people who are doing things well.
I mean, if you're extremely ill in Canada, they're not going to let you fall to the side of the road, right? So I think it's up to everybody to do their part, and in that sense, healthy eating, healthy living, things of that nature. I know it's not always easy, but you have to give the effort.
I think education for health science education in general, it's really demanding. When you look at other countries where they sort of have like a 6-year program, no med school, it's like all in one, and you just go into your residency or take an exam. It's much better. I think sort of promoting, I guess, better support for students who do want to pursue it as a career would be also good. Really fixing up pay as well. A lot of nurses are fairly underpaid. Doctors are underpaid, as it's not like in the United States where it's sort of, privatized. It's public here, so there's a certain pay. Typically, a lot of doctors do tend to move to other countries after graduating in Canada. So I think that's something you want to look at for sure.
I would say listen to the nurses more, because they do a lot of stuff that goes like unseen and stuff, and everyone just thinks about the doctors. But I think the nurses are like the underrated heroes here. So I think just listening to them and their wants and demands are really important.
Yes, for sure. I think access to specialists more quickly. Like, I know I have an aunt who's been waiting for a dermatologist for like months. And so certain areas like that could probably be fixed and more focus on specialties. Like, in some respects, yes, it's great. If you find out you have cancer, you're going to start your cancer treatment like fairly quickly. But at the same time, there's certain things like you do have to wait a long time for.